Hello friends, today we are going to discuss atrial fibrillation. Now what is atrial fibrillation? Atrial fibrillation is a type of supraventricular tachyarrhythmia which is characterized by disorganized, rapid, irregular electrical activity in the atrium which causes ineffective atrial contraction and irregular ventricular rhythm. Normally, a heartbeat is controlled by SA node in a sinus rhythm. In atrial fibrillation, there is multiple electrical impulses fire chaotically from different areas of the atrium, which causes atrium to fibrillate instead of effective atrial contraction. Now, what are the different types of atrial fibrillation? So first is paroxysmal atrial fibrillation. In paroxysmal atrial fibrillation, episode terminate spontaneously within less than 7 days. Second, persistent atrial fibrillation. In persistent atrial fibrillation, episode lasts for more than 7 days and patient may require medical or electrical cardioversion. Third, long-standing persistent atrial fibrillation. In this case, atrial fibrillation lasts for more than 12 months. And last, fourth, permanent atrial fibrillation. In this category, atrial fibrillation persists continuously. Now, what are the causes of atrial fibrillation? Causes of atrial fibrillation can be classified into first, cardiac causes, second, non-cardiac causes. Now, coming to cardiac causes first. Hypertension, which is the most common cause. Second, coronary artery disease, myocardial infarction. Third, valvular heart disease in the form of mitral stenosis or mitral regurgitation. Fourth, heart failure. Fifth, cardiomyopathy. Sixth, post-cardiac surgery. Now, coming to non-cardiac causes. Non-cardiac causes of atrial fibrillation may include first, excess alcohol intake, which is also called as holiday heart syndrome. Second, hyperthyroidism, thyrotoxicosis. Third, COPD or pulmonary embolism. Fourth, in patients with electrolyte imbalance, for example, hypokalemia or hypomagnesemia. Then, in patients with obesity and sleep apnea. Now, we will go through the pathophysiology of atrial fibrillation. Atrial fibrillation occurs due to abnormal automaticity and multiple re-entry circuit in the atrium, usually close to the origin of pulmonary veins. Now we will go through the steps. Step number 1, which is a trigger. So abnormal impulse originate in the atria, in proximal to the origin of pulmonary vein, which leads to dilatation of the atria along with fibrosis, which makes conduction uneven. Activation of multiple re-entry circuit causes chaotic atrial contractions. The atrial contraction rate can go as high as 350 to 600 beats per minute. Then AV node. So AV node conducts these impulses to the ventricles in an irregular manner, leading to irregular ventricular rhythm. So ventricles contract at a rate of 100 to 180 beats per minute. So what is the consequence? The consequence is ineffective atrial contraction, which causes decrease in output, stasis of blood in left atrium, which causes clot formation or thrombus formation, especially in left atrial appendage. Now we will go through the clinical features in a patient with atrial fibrillation. Patients with atrial fibrillation may present with palpitation, chest discomfort, dyspnea or shortness of breath, dizziness or syncope, and fatigue or exercise intolerance. At times, patient may be asymptomatic. Atrial fibrillation may be an incidental finding in such patients. Then we can go through certain signs. For example, when we check the pulse, we can find it would be irregular. Then when we look at the JVP, the A waves will be absent in a patient with atrial fibrillation on JVP. Then certain findings that may suggest underlying pathology. For example, murmurs in certain valvular heart disease and signs of heart failure. Now we will go through investigations in a patient with atrial fibrillation. So first is ECG. In ECG, P waves are absent and irregular RR interval is present. Second, echocardiography. On echocardiography, we can detect the underlying cause of atrial fibrillation. For example, coronary artery disease or valvular heart disease. We can assess left ventricular ejection fraction, and we can also detect complications in the form of thrombus. Then coming to other investigations, for example, thyroid function test. As we have already discussed, thyrotoxicosis could be a cause of atrial fibrillation. Then renal function test, liver function test, and serum magnesium levels. We can get chest X-ray done to look for cardiomegaly and signs of heart failure. Thank you.